Hello friends, I'm Dr. Ravinder Kaur from Amarjeet Fertility Center and I will be speaking on probiotics today. So the word probiotic means pro means for and bios means life. So the probiotics are basically healthy microorganisms which when administered in small or in adequate amounts they confer a health benefit to the host. And the whole idea behind probiotics is to have a healthy lifestyle by improving the internal microbiota and to find the most suitable microorganism which can have a health benefit to the host and it can prevent the diseases. And this goal can be achieved by having good bacteria at the right place. So what do these probiotics they do? They boost the immunity system, they prevent the infection, and they eliminate the hostile bacteria by preventing their colonization, and so it also improves the overall health of the person. So, as we know that the male and the female infertility is on the rise, and around the world, 10% of the population in the reproductive age is suffering from infertility. And infertility is a multifactorial issue. And so, what does vaginal microbiome has to do with infertility? So, we have seen that the vagina is considered a major site of studying the bacterial microbiome in the human body these days. And we know that there are certain beneficial bacteria in the vagina which are a key to solving many infertility problems these days. And the vagina is dominated by lactobacilli species which prevent the many infections or pathogens from infecting the female genital tract. We all know that there are good bacteria in our stomach. So, similarly, there are good bacteria in the uterus also. These good bacteria they prevent the uterus from any infections, and any infection in the uterus is a serious threat to the fertility and to the pregnancy outcomes also. Because if there is any infection in the uterus, it will lead to implantation failures, the failures of IVF cycles, and then there are premature births, and they also lead to postpartum complications. And if there is any infection in the uterus, there is a likelihood that it might travel into the tubes and into the pelvis, also leading to tubal blockage and PID, and thus leading to infertility. So these good bacteria, they are a key to solving many infertility issues. These bacteria, they prevent as I told you, they prevent the uterus from infections, and it has been found that they play a key role in the ART, because the success of the IVF cycle, it depends upon the composition of the vaginal microflora at the time of the embryo transfers, and higher success rates and pregnancy outcomes were found in the patients those who had lactobacilli species in the vagina at the time of the transfers. And there is a uterine microbiome which refers to the healthy microorganisms, including the bacteria, the fungi, and the viruses present in the healthy uterus. How can these special probiotics administration they help in the IVF? So it has been seen that the administration of lactobacilli species they restore the normal vaginal microflora, and they displace the bad bacteria, and thus preventing infections and thus improving the fertility and the pregnancy outcomes. And it has also been proven that these probiotic administration they work better in the infections than the antibiotics which we normally give during infections. And the success of IVF, it has been proved that it will depend upon the composition of the microflora present in the vagina at the time of embryo transfer, and the patients in whom there was lactobacilli dominance in the vagina at the time of embryo transfer, they had better success rates. And it has there has been a study in which there's that they had colonized the tip of the embryo transfer catheter with lactobacilli, and the implantation rates and the live birth rates, they were much more. And it has also been found that it has these lactobacilli, they reduce the inflammation, and they have solved many fertility problems in the PCOD patients also. Thank you.